Rubella virus vaccine injection. Rubella is usually a mild illness causing a rash, sore throat and swollen glands. However, if a pregnant woman has rubella, the virus is likely to cause serious damage to the unborn child or cause a miscarriage. Rubella can lead to damage to the heart, brain, hearing and sight. The baby is likely to be born with a very serious condition called the congenital rubella syndrome. Since rubella immunization was introduced in 1970, there has been a dramatic fall in the number of babies born with the congenital rubella syndrome. Rubella is now a very uncommon infection in the UK as a result of the vaccination program. Rubella vaccine is a vaccine used to prevent rubella. Effectiveness begins about 2 weeks after a single dose and around 95% of people become immune. Countries with higher rates of immunization no longer see cases of rubella or congenital rubella syndrome. When there is a low level of childhood immunization in a population, it is possible for rates of congenital rubella to increase as more women make it to childbearing age without either vaccination or exposure to the disease. Therefore, it is important for more than 80% of people to be vaccinated. The World Health Organization recommended that the rubella vaccine be included in routine vaccinations. If not all people are immunized, then at least women of childbearing age should be immunized. It should not be given to those who are pregnant or those with very poor immune function. While 1 dose is often all that is required for lifelong protection, often 2 doses are given. Side effects are generally mild. They may include fever, rash, and pain and redness at the site of injection. Joint pain may be reported at between 1 and 3 weeks following vaccination in women. Severe allergies are rare. The rubella vaccine is available either by itself or in combination with other vaccines. Combinations include with measles and mumps vaccine and measles, mumps and varicella vaccine. A rubella vaccine was first licensed in 1969. It is on the World Health Organization's list of essential medicines, the most effective and safe medicines needed in a health system. As of 2009, more than 130 countries included it in their routine vaccinations. The wholesale cost of the MMR vaccine in the developing world is 24 US cents per dose as of 2014. In the United States it costs between $50 and $100 USD. Rubella virus vaccine is used for preventing rubella. Rubella virus vaccine is a vaccine. It works by stimulating the body to produce antibodies to rubella. Do not use rubella virus vaccine if you are allergic to any ingredient in rubella virus vaccine. You have a weakened immune system, e.g., advanced HIV, AIDS, decreased gamma globulin levels, blood problems, or tuberculosis. You are pregnant. Contact your doctor or healthcare provider right away if any of these apply to you. Before using rubella virus vaccine, some medical conditions may interact with rubella virus vaccine. Tell your doctor or pharmacist if you have any medical conditions, especially if any of the following apply to you. If you are planning to become pregnant or are breastfeeding. If you are taking any prescription or non-prescription medicine, herbal preparation, or dietary supplement. If you have allergies to medicines, foods, or other substances. If you are allergic to neomycin. If you have a fever, a tumor, HIV, or a family history of weak immune systems. If you have had a recent blood or plasma transfusion, or have received immune globulin or a tuberculin test. Some medicines may interact with rubella virus vaccine. Tell your healthcare provider if you are taking any other medicines, especially any of the following. corticosteroids because the effectiveness of rubella virus vaccine may be decreased, or risk of infection may be increased. Immunosuppressants because the effectiveness of rubella virus vaccine may be decreased. This may not be a complete list of all interactions that may occur. Ask your healthcare provider if rubella virus vaccine may interact with other medicines that you take. Check with your healthcare provider before you start, stop, or change the dose of any medicine. How to use rubella virus vaccine. Use rubella virus vaccine as directed by your doctor. Check the label on the medicine for exact dosing instructions. Rubella virus vaccine is usually administered as an injection at your doctor's office, hospital, or clinic. If you are using rubella virus vaccine at home, carefully follow the injection procedures taught to you by your healthcare provider. If rubella virus vaccine contains particles or is discolored, or if the vial is cracked or damaged in any way, do not use it. Keep this product, as well as syringes and needles, out of the reach of children and away from pets. Do not reuse needles, syringes, or other materials. Dispose of properly after use. Ask your doctor or pharmacist to explain local regulations for proper disposal. If you miss a dose of rubella virus vaccine, contact your doctor to set up a new dosing schedule. Ask your healthcare provider any questions you may have about how to use rubella virus vaccine. Important safety information. Rubella virus vaccine may cause dizziness. Do not drive, operate machinery, or do anything else that could be dangerous until you know how you react to rubella virus vaccine. Adult women may experience joint pain 2 to 4 weeks after receiving this injection. This usually lasts only a short time. However, these symptoms have persisted for months or, rarely, years. Rubella virus vaccine may decrease the effectiveness of tuberculin tests. If you are scheduled to have a TB test within 6 weeks after receiving this vaccination, contact your doctor. You may need to reschedule your TB test. Keep written documentation of all vaccinations received to help avoid unnecessary doses. Use of rubella virus vaccine is not recommended in children younger than 12 months of age. Safety and effectiveness in this age group have not been confirmed. Pregnancy and breastfeeding. Do not use rubella virus vaccine if you are pregnant. If you suspect that you could be pregnant, contact your doctor immediately. Avoid becoming pregnant for at least 3 months after receiving rubella virus vaccine. Rubella virus vaccine is excreted in breast milk. If you are or will be breastfeeding while you are using rubella virus vaccine, check with your doctor or pharmacist to discuss the risks to your baby. Rubella virus vaccine injection, and how does it work? The rubella vaccine is a live vaccine that is used to prevent rubella infection. Rubella is a highly contagious disease that is caused by a virus. In children, the disease is usually mild with fever and a rash. However, rubella is especially dangerous during pregnancy as it can cause a miscarriage or serious birth defects. Fortunately, rubella can be prevented with vaccination. Rubella vaccine is a live attenuated form of the rubella viruses. The vaccine works by stimulating our immune system to produce antibodies against the rubella virus. The rubella live vaccine is no longer available in the US and has been replaced with the measles, mumps, and rubella vaccine. The measles, mumps, and rubella vaccine is a single injection that contains all 3 vaccines, providing protection from all 3 infections. Side effects of rubella virus vaccine injection: fever, headache, dizziness, tiredness, irritability, diarrhea, vomiting, nausea, decrease in platelet count, increase in white blood cell count, allergic reactions, muscle pain, joint pain, brain infection, Guillain-Barré syndrome, numbness, rash, deafness, eye problems, death. The vaccine. Rubella vaccine is only available as part of the measles, mumps and rubella vaccine. 2 doses of the vaccine are needed to provide satisfactory protection against rubella. The first dose of vaccine is usually given as the MMR vaccine between 12 and 13 months of age. It is usually given at the same time as the pneumococcal vaccine. A second dose is usually given at age 3 years and 4 months to 5 years at the same time as the preschool booster of TAP-IPV. TAP stands for diphtheria, tetanus and acellular pertussis. IPV stands for inactivated polio vaccine. Polio is short for poliomyelitis. If a dose of MMR is delayed for any reason, it can still be given at a later age. If necessary, MMR vaccine can be given at any age. The second dose is then given 1 month after the first one. However, if the first dose of MMR has been given when the child is under 1 year old, for example, if they are traveling to an area with rubella so need the vaccine early, then 2 further doses of the vaccine are then needed. Before you become pregnant. Even if you have had a rubella immunization, or have had rubella, there is still a small chance that your body has not made enough antibodies against the rubella virus to protect you. The only way to check whether the immunization has worked is to have a blood test. This checks for rubella antibodies. Because their congenital rubella syndrome is so important to avoid, if you are thinking about becoming pregnant for the first time, you should have a blood test to check that you are protected. This blood test may be offered to younger women in routine health checks. But, if you have not had it, ask your practice nurse for the blood test. In particular, women who have come to the UK from overseas and have not been immunized are at greatest risk of having a baby with congenital rubella syndrome. When you are pregnant, one of the routine blood tests taken in early pregnancy checks for rubella antibodies. In most women the test is positive, which means that you are protected from rubella. If your test is negative, you are at risk if you come into contact with rubella. You should keep away from people who might have rubella. Once your baby is born, you should then have a rubella immunization to protect against rubella in future pregnancies. Symptoms. Symptoms of rubella may include a rash, slight fever, aching joints, and reddened eyes. The rash first appears on the face and spreads from head to toe. There. Lymph nodes just behind the ears and at the back of the neck may swell, causing soreness and pain. Many people with rubella have few or no symptoms, and up to half of the people who have the disease may not get a rash. In most cases of rubella, symptoms appear within 16 to 18 days after exposure to the virus. Prevention. There is a safe and effective vaccine to protect against rubella. The vaccine is given as part of a combination vaccine, called the MMR vaccine, that protects against measles, mumps, and rubella. Who should get vaccinated against rubella with MMR vaccine? Adults born in 1957 or later and non-pregnant women of childbearing age, no matter what year they were born, should receive at least 1 dose of the MMR vaccine. Unless they have a contraindication or documentation of vaccination with at least 1 dose of rubella-containing vaccine or other acceptable evidence of immunity to rubella. College and university students. Healthcare personnel and international travelers are at increased risk for rubella and should receive one dose of the MMR vaccine or have other acceptable evidence of immunity to rubella, regardless of age, to ensure adequate protection. Vaccine safety. The MMR vaccine is very safe and highly effective with few side effects. Mild reactions such as fever, redness, or swelling at the injection site have been reported. Adult women may infrequently have joint symptoms like pain and stiffness from the rubella part of the vaccine. As with any medicine, there are very small risks that serious problems could occur after getting the vaccine. However, the potential risks associated with measles, mumps, and rubella are much greater than their potential risks associated with the vaccine. MMR vaccine should not be given to persons who are pregnant or severely immunosuppressed. Disease and vaccine facts. Rubella can be prevented with a safe and effective vaccine. Rubella is contagious from 7 days before until 7 days after the rash appears. In most cases of rubella, symptoms appear within 16 to 18 days, and 20 to 50% of people may not exhibit symptoms. If a pregnant woman gets rubella during the first 3 months of pregnancy, her baby has a good chance of having serious birth defects such as deafness, cataracts, heart defects, liver and spleen damage, and mental retardation. From 2001 to 2010, 79% of all reported cases of rubella occurred among people aged 15 years and older. For infants and children, children should receive 2 doses of MMR vaccine. First dose, 12 through 15 months. Second dose, 4 through 6 years old. MMRV vaccine is licensed for children 12 months to 12 years old and may be used in place of MMR vaccine if varicella vaccination is also needed. A healthcare provider can help decide which vaccine to use. MMR vaccine is very safe and effective. MMR vaccine is the best way to protect children against rubella and to prevent them from spreading the disease to pregnant women and their unborn babies. For adults, anyone born during or after 1957, who has never had rubella or has never been vaccinated against rubella should receive at least 1 dose of MMR vaccine. If you are not sure if you are protected against rubella, first try to find your vaccination records or documentation of rubella immunity. If you do not have written documentation of rubella immunity, you should get MMR vaccine. Another option is to have a doctor test your blood to determine whether you're immune, but this is likely to cost more and will take 2 doctors' visits. There is no harm in getting another dose of MMR vaccine if you may already be immune to rubella. Women who are planning to become pregnant should make sure they have a pre-pregnancy blood test to see if they are immune to rubella. Most women of childbearing age were vaccinated as children with the MMR vaccine, but they should confirm this with their doctor. If they need to get vaccinated for rubella, they should avoid becoming pregnant until 1 month after receiving the MMR vaccine and, ideally, not until your immunity is confirmed by a blood test. General information. If you have any questions about rubella virus vaccine, please talk with your doctor, pharmacist, or other healthcare provider. Rubella virus vaccine is to be used only by the patient for whom it is prescribed. Do not share it with other people. If your symptoms do not improve or if they become worse, check with your doctor. Check with your pharmacist about how to dispose of unused medicine. This information should not be used to decide whether or not to take rubella virus vaccine or any other medicine. Only your healthcare provider has their knowledge and training to decide which medicines are right for you. This information does not endorse any medicine as safe, effective, or approved for treating any patient or health condition. This is only a brief summary of general information about rubella virus vaccine. It does not include all information about the possible uses, directions, warnings, precautions, interactions, adverse effects, or risks that may apply to rubella virus vaccine. This information is not specific medical advice and does not replace information you receive from your healthcare provider. You must talk with your healthcare provider for complete information about the risks and benefits of using rubella virus vaccine.